So what is the clap?
Well, when I was young, the clap referred to gonorrhea, and I think it still does mostly, but I think there have been uses of the word the clap to just refer to any STI. Sometimes it's even, I think, been referred to herpes sometimes. But yes, I'm going to answer this question referring to gonorrhea, which is another bacterial STI. Now, gonorrhea is much less prevalent in Australia than something like chlamydia, except in certain populations. So gonorrhea is more likely, not more likely than chlamydia, but it's much more common to see it in men who have sex with men and in young populations of young Aboriginal and Torres Strait Islander people, particularly those in remote parts of the country. And the other population that we see gonorrhea in more commonly are people who have returned from overseas where they've had sex with people in countries where there's a lot more gonorrhea around. So it's one of those infections that really varies with country and region and population. And that's true for a lot of communicable diseases, in fact. So gonorrhea, like chlamydia, it infects similar tissues to what chlamydia does. It is more likely than chlamydia to cause symptoms, and that's like a vaginal discharge. In a man, it's a discharge from the urethra. That can be quite painful, but it can also be asymptomatic. And in fact, I would say in the last few years, most of the gonorrhea that I've picked up in the clients that I see have been asymptomatic, and we've just been sort of screening them. Chlamydia is very likely to be asymptomatic, gonorrhea much less so, but we do see it asymptomatically. Now, as probably many people know, something like chlamydia is cured, easily cured and gotten rid of with one dose of antibiotics for the great majority of people, if it hasn't become a complicated infection. And by that, I mean hasn't gone up into the pelvis and caused problems with pelvic inflammatory disease, and in the man gone up into the epididymis and caused more complications there. Gonorrhea similarly can cause pelvic inflammatory disease and can cause infection of the epididymis in men and further things as well. But it is treatable with one dose, usually just one dose, but it's a painful injection. And you also have to take oral antibiotics. The difference with gonorrhea, unlike chlamydia, is that we are seeing, in fact, not just starting to, we have seen for a while, the development or the emergence of antibiotic resistance to gonorrhea. And that's why, if possible, even though we can pick up gonorrhea with the same urine test as chlamydia, in an ideal world, if we do diagnose gonorrhea in a person, if at all possible, we should try to get a swab and send it off to a laboratory to have the culture and sensitivity, the antibiotic sensitivity looked at, because that's the best way for us to see whether we're seeing these patterns of resistance developing. And it's likely to become a really big problem, because if we get to a stage where all the best antibiotics for gonorrhea are now, there's resistance to them, we start to get into trouble. So it's just something that I think certainly New South Wales Health, but also everywhere around the world really, are starting to take notice of and be concerned about.
Absolutely. And is it true that as individuals we can avoid some of that resistance? So, for example, a lot of people might be prescribed an antibiotic that's a 7-day course. They get to day 3 and they start to feel okay. So then they don't take days 4, 5, 6, 7.
Yeah.
Is it true that we can start to avoid some of that resistance by taking those full courses and not just cutting it off when we feel better?
Yeah, that's part of certainly the general wisdom, but also the scientific evidence that if we only partly treat an infection, we might eliminate the symptoms, but we allow the bacteria to sort of grumble on at a lower level. And of course, bacteria, as we're seeing even with COVID viruses, all these microorganisms are really smart. They mutate a little bit, they become resistant to things. So that's absolutely one reason why you know, when the doctor writes a prescription, says take the whole course, it's not just because they, you know, they think it sounds good, or, you know, it's because there is some evidence that it can contribute to the development of resistance, in the same way that taking antibiotics willy-nilly when you don't really need them, and doctors are responsible for example, over-prescribing antibiotics when people have a cold, you know, just a common cold or a sore throat or a head cold. Most of those are caused by viruses. Antibiotics make no difference at all. Yeah. So the medical profession is also has contributed to the development of resistance through unnecessarily prescribing antibiotics.
Right. Great response. Thanks, Mel.